and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we're getting ready for the Gold Neonatal Online Conference of 2021. And one of our speakers is here with me, Dr. Kelly McGlothen-Bell. Dr. Kelly, it's so nice to have you back here.
Thank you. I'm so happy to be with you all again.
Oh, it's lovely to have you back by popular demand. That's absolutely fabulous. Feel very honored to have you back here.
Thank you.
Tell us a little bit, where in the world are you located? And let us know a little bit about your background for our viewers who have not yet met you.
Perfect. So I am from the Lone Star State, Texas.
Mhm.
I reside in San Antonio, home of the Alamo, the Great Spurs. We're a big basketball town here, so you will hear my love for them constantly. I am currently a nurse and assistant professor with the School of Nursing. I've been a nurse for approximately 8 years now. Always worked with mother babies and within the realm of lactation consulting. So I have a strong passion for supporting mom baby dyads and their families. And so San Antonio provides me with a great home in the community in which I can do so. So I'm very fortunate in that way.
Oh, beautiful. Thank you so much for sharing that. Let me ask you this. Are you also in a teaching hospital? Are you working there as well? Is that a
So I
teaching?
do. I am affiliated with a teaching hospital. I do a lot of clinicals there with students. Although I'm not currently working there,
Mhm.
we do collaborate with them very, very often.
Mhm. And your background, you are specialized in neonatal care as well. Tell us a little bit about your work in the field there as well and your research.
Sure. So I got started off working at a teaching hospital, which also functions as our county hospital, like I said, a couple years ago. And that was working within the mother baby unit. And so within this facility, we work with a myriad of patients from various backgrounds, some indigent populations, some who come from um, some more poor conditions, and then some who are very affluent. And
Mhm.
so it's a great wonder to be able to see healthcare through the eyes of the patients.
Mhm.
But one population I really became interested in working with was mothers who had a history of substance use disorders.
Okay.
And so back when I first started nursing, this issue of the opioid epidemic was really just kind of getting started.
Mhm.
And unfortunately, we didn't know how to properly care for these mamas, let alone their babies.
Mhm.
And then we didn't know how to care for them together. So this was a big issue
Yeah.
for us in terms of standard of care and the quality of care that we were able to give to patients. And so we want to make sure that, of course, the care that we're providing to them is always the utmost quality.
Mhm.
And so, not too long after getting started there, I also got my lactation consultant designation. And so I began working specifically within lactation in the neonatal NICU unit as well
Mhm.
as in the mother baby unit. And we were seeing more and more moms coming in, wanting to breastfeed their babies, wanting and having questions about feeding. That's really what got me passionate about working and asking questions related to feeding within mother baby diets impacted by opioid exposure.
Oh, fabulous. You have a wonderful background there, and the work you're doing is so important there out there in the field there as well. I have to ask you this question. We are aware now of the opioid epidemic. It's still growing, of course, it's exploding. Now, in the context of COVID, what do you see? Do you see an increase even further? Tell me a little bit about what you see.
Yeah. So, unfortunately, we don't have the data to support this yet, but anecdotally, we are seeing increased numbers of women of childbearing age being affected by opioid use disorders, particularly in the time of COVID. We were kind of seeing somewhat of a plateau prior to COVID, but since then, we are seeing our numbers increase, unfortunately.
Mhm.
And I think that has a lot to do with this idea of isolation that
Yeah.
unfortunately happened during quarantine. And although a lot of service providers do their best, of course, to remain engaged with moms and their babies, obviously it becomes a little bit more difficult when there's a lot of with what's going on with the pandemic. And so there are some gaps that we still see in the services that are being provided or our ability to engage women in the time of COVID. But I think that that's largely being recognized now. And so more
Hmm.
efforts are being put towards how do we engage moms who we may not be able to be face to face with as we used to be.
Hmm.
And so I think, the strategies are really strengthening themselves. And from what I've talked, when I'm talked to mothers, they feel a lot more supported now.
Oh,
But it
good.
was a large adjustment period,
Yeah.
obviously, during the pandemic.
Yeah, I can imagine large adjustment time there, and we know so little going into this, right? I
Hmm.
mean, were guessing and not quite. We didn't have the data yet. We didn't know, yeah, what was coming, what was still to come. So I know you're more involved in the postpartum neonatal area, but do you think with COVID we missed a lot also prenatally, where we probably would have seen more and be able to help more in that period, but with COVID being everything being pushed out and delayed because there was no face-to-face interaction or less face-to-face interaction?
I do. Unfortunately, already women who with substance use disorders have high disparities in accessing
Hmm.
prenatal care,
Yeah.
and so I think that was only heightened even more
Hmm.
during COVID. And hopefully, like I said, hopefully the new strategies that are being put in place will really help to kind of mitigate that issue. But I
Hmm.
definitely feel that there was a larger problem in the
Yeah.
prenatal period.
Mm. Well, thank you for sharing that. Now to your presentation. As you mentioned, you're very much, interested, and it became a passion for you. The feeding behaviors in the opioid-exposed infant
Hmm.
that you're working with that population. I can imagine, that there are many challenging challenges for these little ones there, especially then when it comes to feeding. And I'm so glad that you're out there assisting those families and in the, in this postpartum period there to
Hmm.
get the little ones off to a good start. So tell us a little bit about what we can look forward to in this presentation.
Sure. So, as many of you know, feeding is perhaps one of the first and most important parts of parenting. And the ways in which that we're able to support mothers and their families to feed their children is very important. And sometimes, as healthcare providers, we ourselves aren't quite sure how to
Hmm.
properly feed or nourish these babies because the care that we provide to them is quite complex. Unfortunately, these little ones have difficulties with articulating their cues to us. And so it takes a very keen eye and lots of observation to really get to know these babies on a one-on-one level and to really
Hmm.
figure out what are they trying to tell us and what are the ways that we can support them to best feed. And so through this presentation, I really hope to provide you all with some tools to look to see how to observe these babies. What are we looking for, and what can we do to help support them in their
Hmm.
feeding as well as their mothers?
Oh, beautiful. I'm very much looking forward to this. And I can imagine there's also a lot of questions and insecurities when it comes to the families and the mothers or the
Hmm.
parents. Often they're told you can't breastfeed with this, this is, you're making your baby sick. And there's a lot of um, incorrect information that is being fed to these families as well. So it goes also into, educating the families as well as working with the little ones, right?
Oh, yes, definitely. I see feeding as one of those areas where it's just ripe for
Yeah.
engaging parents, whether
Yes.
that be through education or helping them to bond with their babies.
Hmm.
And that's all any mom wants to do, right? They want to be there
Yeah.
for their baby and they want to support their baby. And so I think sometimes these moms feel very stigmatized,
Yes.
and
Hmm.
truthfully, they are in a sense. And so we want to make sure that we are supporting them and helping them not to feel judged and helping to remind them that they are what's best for their baby. And if we
Hmm.
can help keep mom and baby together and help support her to, get to know her baby even better, that's only good for the little one. And so I think that's, what our overall goal is to help have a healthy mom and a healthy baby
Oh,
and a
yes.
happy mom and a happy
And
baby.
yes, and keeping mom and baby together, as you mentioned, is so important
Hmm.
in the process. Well, thank you so much, Dr. Kelly McGlothen-Bell, for talking here with me, sitting down here with me. I know you have a very busy schedule, so we really appreciate it. And we are looking forward to your presentation here
Thank
at
you
the
so
Global
much.
Neonatal Conference coming up here.
I'm looking forward to it as well. Thank you so much for having me.
Thank you. And for our viewers, if you would like to find out more about this presentation and the other presentations in the Gold Neonatal Online Conference of 2021, we would like to invite you to visit goldneonatal.com. And we get started with the conference on June 1st. This presentation will be live on June 7th, but don't worry, all the presentations are being recorded so you can always enjoy them at a time that is convenient for you. So thank you everyone for watching, and I hope to see you at the conference. Bye bye, everyone.